Thank you for being so patient with us. A warm, a good day for all the teachers, principals, faculty members who have gathered with us for this webinar. I welcome you all with for the series of webinar which we have termed Dealing with this Global Experiment. And today's session, Minding Our Mind in 2020, will be the first of the series. I wish and I hope that this webinar, through this webinar as a platform, we can identify our vulnerable spot, gain understanding, focus on essential aspects, and improve ourselves. With this in our thought, let us go ahead for the general instructions. And the general instructions are very similar, very simple. Teachers, kindly stay muted throughout the session. And if you have any question at all regarding the session, please post it in the chat box privately to the host, and only to the host post your queries and your questions. If you have joined with us using Zoom, you can post it in the chat box. But if you have connected to us through YouTube, you can use the comment section in the YouTube, address it with @host, and then you can post your queries. And if there are any technical difficulties that you face during the session, you can contact our technical support, Mr. Samuel Martin, whose phone number and mail ID is listed on the screen for you to note. Mr. Samuel Martin will be available throughout the session for you, and he'll be assisting you if there's any technical query. If you're not able to connect through the Zoom, or if there's any such queries, kindly contact Mr. Samuel Martin. And to add on to the instruction, at the end of the session, there will be a feedback form for which a link will be sent to you. We'll be sending a link to you for filling in your feedback forms. And with the details that you provide in the feedback form, we will send you an online certificate. The certificate will reach you in a day or two. Okay. So I request you once again, just kindly stay muted throughout the session. Techno School. I will introduce Techno School to you. For many of you, we are not new, and for few of you, we are new. So to all those for whom we are new, it is my responsibility to introduce Techno School. Techno School is an ICT education solution provider, and we started with a vision to help schools to keep them in pace with the ongoing ICT industry. As we all know, this industry grows as we speak, and there are new inventions and new technologies every day. So we want our students to keep themselves on power with this ongoing demand. So with this as a mind, we started this company, Techno School. And we have successfully established ourselves not only in India, we are across India, not just only in India, we are also in UAE. And we have partnered with 800 plus schools across India. Apart from this global curriculum that we provide, we connect with our customer schools by providing them value-added services. So in terms of value-added services, we provide our school teachers technical training, our customer school teachers with technical training and workshops. For students, we provide motivational sessions and career-oriented seminars. So as you see on your screen, we have 800 plus schools in 15 different locations, and we are in business for 15 years. Successfully running, I should add. So our presence is felt in India, as I told you a minute back, and we are also in the UAE. So as I was telling you, we have our value-added services, right? So one such value-added service is Techno Talent Fest. So with the help of this Techno Talent Fest, we give an opportunity or a platform for schools to identify their tech geniuses. So it's once in a year competition that we conduct for across the states of India, and UAE it is interstate wise. And these are few glimpses of students who have achieved and who have won the competition. You can follow us on Twitter, Instagram, and Facebook. And gentle reminder, kindly stay muted. And at the end of the session, there will be a feedback form link that will be sent to you. You can click on the link, fill all the details. Upon the details that you provide, we will send you the certificate through your mail that you provide. I did explain about the value added services, technical training, and the workshop. And let us move to the important session of the day, the training program, Minding Our Mind. It is my privilege and honor to introduce the speaker of the day. She has found time amidst of her busy schedule. She has found time, and she is with us today. It's Dr. Miriam Samuel, the head of Social Works Department, Madras Christian College, Chennai. She is an ardent supporter of mental health for various groups of society. She has addressed many national and international programs on mental well-being of teachers, teaching staffs across the globe. She has made valuable contribution to the field of social work and psychiatry. She has she has been an important member in curriculum development in social works. Ma'am, I hand over this session to you.
Yeah, thank you, Sharon, for that introduction and for inviting me to take this session. Good afternoon to all the dear teachers gathered from across. I heard South India. That's what Sharon told me. I do not know if there is anybody from the North also here. But very happy to see almost it shows 500 on my screen here. Okay, so about 500 participants here, and I've been seeing the messages coming in, from different parts of the place of our country. There are people here online and different schools. I'm very happy to see you all and to connect with you all this afternoon. I hope my voice is clear and yes.
Yes, ma'am, I can hear you loud and
Thank you.
clear.
Thank you so much, Sharon. Yeah, so I hope my voice is clear. If the voice is not clear, then you have to check your audio, dear teachers. Just check if there's some problem with your audio. Fine. So as Sharon said, my name is Miriam Samuel and I teach social work master's program, MSW, at the Madras Christian College. I've been working there for the last 31 years. So you can imagine my experience there, and I enjoy teaching. I enjoy being a teacher, and so it's a privilege for me to connect with you all, dear teachers. So even in the midst of this pandemic, I have enjoyed myself. So 31 years means I'm quite an old teacher, almost ready for retirement another 2 years. And so therefore, for me also, the pandemic has been a struggle of moving from the familiar chalk and talk method to technology and learning Zoom, learning Google Meet, learning how to share on Zoom and on Google, correcting papers online. Everything has been a challenge, but let me assure you, it has also been a great learning experience, simply because I have been able to put things into perspective. And that is what I will be sharing with you all. So it's about 3:10. Sharon, how long do you want me to speak?
Ma'am, you can continue as far as you like feel that you have completed the purpose of the meeting. Let's
Oh,
say
they will all
35.
run away if you let me speak. I can go on and on. They will never come back for another session. Okay. Yeah. So maybe half an hour till
Yes, ma'am.
3:45, and then we will
Yes,
have
ma'am.
some
That will
time
be
if there's
perfect.
any questions that they can send to the host, and you can ask me, and let me see how best I can answer. I'm going to share my screen now. It'll just give me a few minutes to do it. Yes, I think I got it. As I told you, all these things are so new to us and it takes some time to get used to it. So I'm sharing. Yes, fine, great. So you have my screen up and you can see my face at the corner of it. So I hope we can connect with each other. Because it's so challenging for us teachers, because we are so used to seeing our students in classroom, we are so used to connecting people with the eye contact, so that's so important in the teaching process. And I think more than any other professional, it is the teachers who have been so challenged during this time, when we moved into a new mode of teaching where we are not able to connect with our students in terms of seeing them physically, or seeing them even virtually. Very often we just see, just screens there with initials, and we don't see the students. And when you ask them to put the video on, they say, "Ma'am, network poor, ma'am, not able to connect." So we really do not know what they're doing on the other side. But we continue in the hope and the trust and the faith that we are reaching out to them and they are listening. I was very recently looking at, there are so many of these forwards, and there was a nice joke which said that all these days when you just looked into the open air and just kept talking, it was called, hallucinations, or that you had some problem in the mind, when you just look at people in the open air talking. But today it is called Zoom and webinars and Google Meets, where we're just looking into a screen. We don't even know who's there or whether people are there or they're listening, and we just keep talking. So that's been my experience. But I have done my best to connect as much as I can. So I'm glad to see you all here. And, I've just been looking at some of your names and schools, and it's been interesting to see that, you've been coming from all kinds of backgrounds, different places. As Sharon told you, the topic that they gave to me was minding our mind. And in the context of this, I have added this saying that, our wellness matters, especially for teachers, because the load on us is so heavy. And therefore, I feel that as we mind our mind, why do we need to mind our mind? Because our wellness, so when I say wellness, it's a total holistic approach that I'm taking. And that's what I'm going to be addressing this afternoon. Why do we need to talk about mental health? What's the reason that we need to talk about mental health? Now, if you've read and you're in touch with what is happening around us, we know that mental health problems are there across our countries, across various socioeconomic and cultural contexts. It is not just a Western problem, it is also our problem, even in our own culture. And there are a number of reports that say that, mental health will be a global burden of disease. We always think global burden of disease is either cardiology or neurology or something like that. But WHO, which is the World Health Organization, says that mental health is going to be the second largest global burden of disease world over, including India. In a context like India, where we have very limited resources for mental health services, I know people don't have access to services on one hand, and there is still so much of stigma on the other hand that people are not approaching mental health services. It is going to be a much greater burden in a country like India. And therefore, I think, in as much as we think of our physical health, we are all concerned about our physical health, what we eat, our weight, what kind of foods we are eating, all kinds of things we talk about. We do regular medical checkups. We check and see if there's a history of any illness. We go for checkups. In as much as we are concerned about our physical health, I think we also need to be concerned about our mental health. So world over, they say that 1 in 4 people have certain mental health problems, and they say about 450 million people suffer from mental health problems. And mental health is one thing that we don't talk about at all, whether it is at the home or in a school or even in a medical field. Mental health gets the least priority in medical education itself. It gets a least priority. And if somebody says, I want to become a psychiatrist or a mental health profession, it is such a stigmatized profession. So, it is not an addressed agenda within the Indian context. And therefore, we need to talk about our mind. We really need to talk about our mind, and our wellness and our mental health is very important. In 2020, this is a very recent report of the World Health Organization, which said that mental health is one of the most neglected areas of public health. and close to 1 billion people are living with mental disorders. 3 million people die every year from harmful use of alcohol or suicide. And they say now the present COVID pandemic situation has worsened the mental health situation in the world, and billions of people around the world have been affected by the pandemic, and this has further impacted the mental health of people. I think this is a very, very important report that is there, which is a very, very recent report from World Health Organization, where we need to understand that pandemics such as this or disasters such as this are impacting mental health of people to a very large extent. And you'll know, as teachers, you are people who are trying to keep up with current affairs. We've looked at the rates of suicides. Look at the rates of child sexual abuse that has increased. Look at the rates of addiction that has increased. Domestic violence, number of issues surrounding domestic violence and alcohol abuse. So this is a major issue that is there, especially in a disaster or a pandemic like COVID, where it impacts us and we really do not know what to do, and people take to other harmful ways of coping with what they are going through. And therefore it is important that we look at our mind and address our well-being. Now, teachers are no exemption to it. We as teachers, I'm a teacher too, so I put myself in this. There are some reports that were available. I was looking for Indian reports, but I could not find any data on mental health among Indian teachers. But they just said that Indian teachers do face a lot of stress. But in general, these are general reports that were there even before the COVID, where the American Federation of Teachers they have put up a report saying 78% of teachers reported of some kind of mental health issues, like feeling exhausted emotionally, feeling exhausted physically. And I'm sure as I'm saying it, a lot of you will understand that, because sometimes we feel so exhausted, especially teachers working with younger children experience a lot of exhaustion as they work with children. There was another report from the health survey of UK, where they said that 75% of teachers, anybody within the teaching profession, said they experience some kind of anxiety or stress. They said they experienced panic attacks, some of them, a very small percentage of them. A lot of them had insomnia and difficulty in sleeping. I experienced certain amount of insomnia last night, and I said, okay, I'm going to address about 500 or 700 teachers, and how am I going to reach out to them over the Zoom where I can't see them? And I'm a very people's person. I like to see people. I like to connect with people. I like to have face contact or eye contact when I address people, and therefore addressing on Zoom creates certain amount of anxiety and leading to sleeplessness. And many of them had difficulty in concentrating. This is something that a lot of my own faculty in colleges and other colleges are experiencing, especially during this COVID, because of the stress that is there, that they find it really difficult concentrating in classes, and they feel that it is very stressful to them. So these are some reports that are there about mental health issues. I'm not saying that these are disease, but just issues or problems that teachers face. Now, mental health and well-being during COVID, we know COVID has impacted us both nationally and internationally. I still remember in December, when Christmas time, we heard about the coronavirus in China. We thought it was a China problem. And as even President Trump mentioned in one of his speeches, he called it the China virus or the Chinese virus. We thought it is a problem of China, and we said, oh, they eat all kinds of things and that's why they get it. Little did we realize that it is going to be so close to us, right at our home. I'm sure there are teachers here who've had loved ones who've experienced symptoms of COVID, neighbors, community, our schools, okay? And within our nation, it's become our problem today. It is no longer somebody else's problem. And this has created a lot of anxiety. We are feeling so overwhelmed by the constantly changing situation that is there. even teachers. Suddenly government says we're going to reopen from November 16th, and we are all thinking, how am I going to cope with it? How am I going to go back? What am I going to do with safety? What about children's safety? And then the government says, no, 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 we're going to wait for some more time. We will tell you after the 23rd. Then they said 11th and 12th can come. Now they say nothing is going to happen. I think there was some news outbreak yesterday saying that till end of December we may not reopen. So there's, we are so overwhelmed by what is happening. We really do not know, because every day there is a new announcement. CBSE boards, if there are people from the CBSE boards, I think they're also started announcing their tentative examination schedules. Curriculum has been changed. You were teaching and suddenly they said, no, this unit has been removed. And I know my daughter is a teacher, and she says, Amma, I've already taught it and I've spent so much of time teaching this particular unit, and now CBSE says this unit is removed. So there is this feeling of being worried because of health, worried for our loved ones, worried especially for elderly members within the family. If your parents, if you have a spouse who's going out every day for work and coming back, so we're really worried about what is happening, and there's a feeling of anxiety and overwhelmed about what is happening around us. In addition to this feeling of anxiety, or being worried, etc., and fear, there is also some stigma that is associated with this particular COVID. And I think the fear is more because, as you see in the first circle I put there, the fear is more because it is new. Anything that is new creates apprehension. Creates apprehension. Anything that is new creates apprehension. There's an anticipation, there is a dread. Sometimes there's anxiety about anything that is new. There's a fear about anything that is new. Always anything that is unknown creates some kind of a negative feeling sometimes, or anxiety that is there, or some kind of a different feeling within us. And we are so afraid of what is unknown. And this fear of the unknown, what are we doing? We are associating with others, and that is what is leading to stigma among our people. And we've heard so many stories over WhatsApp and the online messages that we get, where people have been stigmatized, families have been stigmatized, communities have been stigmatized, doctors and frontline workers have been stigmatized. So this is common problems that we see around us. So what are the common mental health problems we see, and why does it happen? So this was a report that was brought out in US, and they say the reason why it is triggering a lot of mental health issues is because of the mindset switch. Mindset switch. So we were, kind of living our life. Suddenly we moved into a survival mode. Okay, we moved into a survival mode. So it is, how do I go about classes today? I need to survive for today. I should have electricity. My Wi-Fi connection should be good. My data pack should be there. My mobile phone should be charged. I should not forget to charge it. It should not rain, because if it rains, the connection will go out. So we are kind of getting into a survival mode. Do I have enough online material to teach today? It's gone into a survival mode. Every day it is a survival mode. And this is what is triggering a lot of issues of insecurity, sense of helplessness and hopelessness, withdrawal sometimes, loneliness. In addition to this, lot of insecurity related with finance, jobs. I know a lot of school teachers who've not been paid their salaries for a few months. I know teachers who have had to take a 50% cut because fees have not been collected. And management is saying, anyway, you're not going to come, you're not coming to school, you're not traveling, so why do you need the full salary? Okay. And in addition to that, anxiety about our family members, anxiety about our own health, all these things together is creating, some kind of a disturbance for all of us. And being at home makes it very difficult to distract. Otherwise, you're out traveling and you distract yourself in so many different ways. And we're not able to do it because we are at home and confines of the home itself. Okay. So this kind of a stress and anxiety can create a lot of things, especially, I know this is a mixed group of men and women, but I did see a larger number of women. And definitely women have a greater stress that they face, also because of the multiple roles that they take on, more responsibility of as carers. within the family, and in addition to other gender factors that are there for women. So there is a lot of fear and worry. There's a lot of disturbances in sleep, in eating habits, in concentration, worsening of health problems because we're not able to go to the hospital. There are a number of reports that say that health problems have worsened because people are afraid to go to the hospitals. So we're not going for our regular checkups, you know. And also there's an increased use of alcohol during this time. A lot of habit formation that has taken place even among children, a lot of online access, online gaming, you know, these are all issues that we are facing during this time, and stress causes all these different reactions. So therefore, if you look at yourself, for instance, even me, when I understand that when I'm very stressed, you know, I have certain physical symptoms like neck tension, very very common among us, especially as we sit the whole day and we're trying to take classes. In addition to the stress of having to reach out to the children, children are disturbed during classes, parents interfere sometimes, interference by the management, and it leads to a lot of tension for us, and sleep problems, lower appetite, you know, a kind of sense of fatigue and lethargy, you know, very tired you feel. Right when you get up in the morning, you just say, yes, I know some teachers who've said, oh, do I have to take classes over Zoom? I wish we didn't have to do it, you know. So there's a sense of fatigue and lethargy, and a lot of psychological and emotional symptoms that we feel. You know, sense of powerlessness. I don't know whether you felt it. I felt it. Suddenly I felt I was so powerless, you know, nothing was within my control. Nothing was within my control. I could not walk freely outside. You know, you can't talk to anybody freely, you can't go to the neighbor's house, you can't go to the market freely. A sense of powerlessness, and you feel that you're not in control of anything. And you know, a lot of negative feelings about what is happening, discouraged or low motivation, you know, these are all issues that are there. And this can lead to behavioral symptoms like irritability, aggression. You know, I know in a lot of families where you have small children, especially teachers who have smaller children at home, we are so irritated with them because, you know, on one hand you have to take the class, on the other hand your children have to attend their classes, and they are calling you and they're not willing to sit by themselves and work. Family expects you to do certain things, and it creates a lot of behavioral symptoms also during this time. And this kind of a stress, or you know, psychological problems that we are facing, or mental health disturbances that we are facing, can, if unchecked, if not looked into, can for a very small percentage of people lead to psychiatric disorders or mental health disorders like anxiety disorders or somatoform disorders, you know, very very common in India, where we are constantly complaining of a physical symptom. You know, I always tell people when I talk to women's group and I ask them, how are you feeling? And I call it the KKK syndrome, the KKK syndrome. So when you talk to women and you ask them how they are, especially women who are stressed, and especially when I work in the communities, I do a lot of grassroots level work with women, and they all say, Amma, kai kal kodachal. Kai kal kodachal, you know. I don't know if there are Hindi speaking people here. They complain of physical symptoms, you know, hand and joint pains and leg pain. You know, pain disorders are very common associated with stress. And panic disorders, sometimes we are so scared of the infection, you know, one sneeze, fever, and this panic in the household. I'm also thinking that the pandemic can lead to more numbers or increase in obsessive compulsive disorders, because we're constantly washing hands, we're washing vegetables, we're washing milk. Who washed milk packets with soap? You know, none of us did it, but a lot of us are doing it now. Yeah. And who we went, you bought a fruit, sometimes you just ate it in the market and came. Today we're so conscious of it, we bring it back, wash it with soda, wash it with salt, and only then we are eating it. Okay. And the mask, and you know, so many things that are there, and so it can lead to obsessive compulsive disorders, phobia, depression, suicidal thoughts, or a general feeling of lack of interest in what is happening around us. Now, as I told you, the education sector is not free from these problems. You know, the education and COVID, Zoom is the buzzword today, you know, and we're all dealing with this online platforms today. And it's 10 months since we shifted to this. We can't Imagine, they said minding the mind in 2020. We are already moving or inching towards 21. Before we realize it, we will be in December next week. And I think we need to move this mindset into 21 also, and take care, mind our mind even in 21, because this has come to stay and we really need to understand this. And we've kind of moved into this new mode. There's a Khan Academy, and they say that this is not online teaching but quarantine teaching. How very true. It's just not online, it's just not ordinary online in normal circumstances. We are in a new normal. This is pandemic online classes, and it is very different from a normal online classes, because there are a lot of the other psychosocial issues that are coming along with it, and therefore this is more quarantine online rather than just online classes. And this has disrupted the lives for many of us. Many of us come from schools where children have access, but we also know children who do not have access. Why? In Madras Christian College itself, when we did a survey, we found that about 500 students had no access to either an Android phone or a laptop in Madras Christian College. Imagine our rural schools, imagine our government schools. So it has kind of changed the lives of people, marginalized communities who have no access. And this change is really challenging for us, because we are staying within our house, we are locked within our house, and it's creating a lot of problems for us. Okay. And also, the assessments have changed. We do not know. Students are writing the test. We are trying our best to monitor, but it is so difficult to really know what the students are doing on the other side. There's a sense of hopelessness on our side as teachers, because how much can we check online? It's such a difficult issue that we are in, and therefore teachers need socioeconomic support to face the pressure and to deliver quality online teaching learning to our students. So if you look at, I called it the challenge galore. So many challenges before us, educational challenges that are there, keeping students on board, attendance monitoring. There's one of the reports that I read in UK. They did a study, a qualitative study, and when they interviewed the teachers, one of the teachers said all of them turned into ghosts. They said all my students turned into ghosts because we're not able to see them. They just ghosts on my screen. No images, just sometimes initials. Sometimes they have some wonky profile pictures there, and we're really not able to see them at all. Managing distractions, cyber safety is another major issue. Zoom bombing. I was in one of these sessions, and it was a horrible Zoom bombing. And it was very, very disturbing. We were not able to handle it, and the host had to cancel the session. So a lot of these issues. And suddenly in March, we all had to move from the normal chalk and talk method into ICT teaching. And so we had to convert all our teaching material into ICT teaching material. It was a big challenge. And we had no technical support. We had to learn it. Okay. Parental role in this entire educational scenario is they're controlling the situation. Parents are sitting in class. Parents are making comments. So economic issues, as I mentioned all earlier, family, the lack of space, of course, multiple roles and family demands. Lack of space is one major issue that a lot of our students are also facing and teachers are facing, because many of us live in just 2-3 room homes, and we are kind of playing musical chairs at home. So I finish a meeting, my husband comes and sits, and then somebody else wants the room, because there's only one place where we can sit, where it is neat and we can use the space. There are students who do not want to come online because of the disturbance at home, violence within the family. Father is alcoholic, he is screaming at home. And there's a student who said, Madam, I do not want to come for online classes because my home is not good. I can't put my video on. So issues like that, emotional issues, burnout, feeling of burnout. How long do we go on like this? I do not know how many of you are saying that. Feeling isolated, no support from our friends. Personal issues, there's a blurring of the personal and professional. There's a blur. Earlier you went to school and you came back, that was it, school was done. Today, even till 8 o'clock, you have meetings. Till 8 o'clock, your principal can call you. At 7 o'clock, a student can call you for a doubt. So there's a blurring of these boundaries that are there between the personal and the professional. Lack of peer support. We are not connected to our teachers. So this is another major problem that is there. Okay. So in this challenge situation, we also need to know that things are not just negative. There have also been, it has opened up a lot of avenues for us. Like there were frontline workers who responded to the situation, doctors, nurses, cleaning staff, paramedical staff, etc. Similarly, I feel that teachers were also in the front line in terms of damage control to our youth and younger population, and ensuring that learning reaches the learners. You've read stories, Kerala, teachers have gone door to door asking their children, do you have access to education? You've read stories in the North India where in a school they put a big microphone in the community, and the teacher would teach over this microphone so that everybody could hear, and the children would sit outside the little hamlets and listen to it. We know states where the government has taken the initiative of having it on Doordarshan and on special TV, so that because TV is something that is there in most families and therefore they can watch it. So teachers have also been frontliners in terms of damage control. And so that's a positive side of it. And in spite of all the odds that are there, we today sit so proudly in front of our class and take our classes every day. And, hats off to all of us teachers. I salute you all for the way in which you're managing your classes. It's very different from a postgraduate class where I have a smaller class and they're PG students, and therefore their maturity is very different. So let's talk about our wellness, because we all know a healthy body in a healthy mind is very important for overall health. And therefore, it is important for us to talk about our wellness. So this part of it will be on wellness. And so when we talk of wellness, it is very holistic in nature. It's not just physical and mental and emotional, but it is also spiritual wellness, your social wellness, even your environmental wellness. Okay. So what are some of the things that we need to do or we can do to stay, mentally alert, to keep our mind in focus, to stay well and healthy during this time, not just physically, but also in terms of our mental health? Exercise every day. I do not know how many of you do it. I have been doing it right from March onwards. I walk every day, except the days it rains. Okay. I skip. If it rains, try skipping. Okay. Do some kind of an exercise every day. Physical wellness is very important. Engage. If you can't exercise, engage in physical activities, movement. That's very important. Any kind of physical activity, that you can be involved in gives a lot of peace of mind. One of the things that many people have done is gardening, for instance. Okay, has been one exercise a lot of people have taken. Healthy food. I do not know if you're conscious of what you're eating during the pandemic, or you have time to think of what you're eating. Have a lot of salads. Keep cut veldrika and keep on your table when you're taking the class. Don't keep murku and mixture. Cut veldrika, cut some carrot and keep it. Buy some puri and keep. Do these kind of exercises, and eat healthy food. Take care of medications if you're under any medication. Avoid overuse of gadgets and focus on other activities within the family, and maintain a schedule. One of the things I have done is right through the pandemic, I have maintained a schedule. Whether I have class or no class, by 6 I'm out. I finish my morning responsibilities. I go to the garden. I finish my watering. I clean my garden. I do all this. And by 8:30, 8:15, I'm ready for college prayer. By 8:30, I'm sitting in front of my laptop doing my work, all dressed up neatly. I know teachers do not do it. I know many teachers who don't do it because they feel we don't have to put the video on. So why do we have to take the trouble of dressing up? Maintain a schedule, because this physical wellness will take care of your mental wellness, which is the next one that I'm going to speak about, saying how physically healthy can keep you away from stress, and being engaged and being involved with other members of the family and having healthy relationships is also very important. Staying connected, gardening, listening to music, playing an instrument. How many of you looked at photographs over the last 10 months? How many of you sat with your children and looked at baby photographs, for instance, with your children? How many of you picked up hobbies that you left out, like poetry writing or stamp collection or coin collection? How many of you started growing at least tomatoes in your house, or at least pachamalaga in your house? How many of you have done it? I think these are important things that we need to do. Or cook something. I've been working for the last 31 years. One of the things that I've done during this last 10 months is really taken trouble to cook and, have different things for the children, because that's something that I could not do rushing as a working woman. Okay. Spiritual wellness. Don't think that I'm talking about a religion. I'm talking of spirituality, which is much beyond religion. Okay, so spiritual wellness is very important. Believe me, I'm a strong advocator of that. How many of you get up in the morning and charge your mobile battery? First thing, you check your battery and charge it. Why aren't you recharging your battery every day? If your mobile battery needs recharging every day, you need recharging every day. And one of the ways that you can recharge is spiritually. Okay, whatever religious background you come from doesn't matter, but this practicing of mindfulness, being in the present, being aware of what is happening to you, aware of what is happening around you, family prayers or individual prayers, or listening to spiritual songs or sermons, or talking to spiritual mentors. Spiritual wellness is very important. Social wellness, also being connected with your neighbors. How many of you spoke to your neighbors over the last 10 months? You don't need to visit them, but over the compound wall, you said, hello, mommy, how are you doing? Or hello to your neighbor and ask them how you're doing. How many of you spoke to the municipality workers who come and clean rubbish every day? Did you ask them what is happening to them? Have you given them a cup of chai? Social wellness is very important to keep yourself connected. And of course, occupational wellness, because you're working from home, make sure that you maintain occupational wellness also as you sit and work every day. And also your surrounding in terms of environmental wellness, hygiene within the house, hygiene outside, because in any disasters like this, environmental wellness is very important for our overall wellness. So the last 2 or 3 slides, I'm just going to talk about certain strategies that you can use that can help you, like certain practices that can help you, which some of them I mentioned, but I just thought I'll put it in points so that you can remember it. Like the first one, I said, stick to a routine. Very important. Please stick to a routine. Whether you have a class at 8:30 or no, please stick to a routine. Okay. And manage your exposure to media. Show compassion and kindness, because that will create a sense of wellness. Generosity, reaching out to others. Are you reaching out to your students? Have you called your students? Have you asked them how they are? Have you made, for instance, suppose you're a class teacher for a particular class. Over the last few months, have you called every single child and found out how they are and whether they and their family is well? Do you know what is happening in their family? Okay, so reaching out to others and keeping yourself busy is very, very important. And communicating with people, and some of the other things I've already mentioned to you, but these are small techniques that you can use as teachers to maintain your wellness. Avoiding stress is important, and by either avoiding it, altering the situation. Adaptability is a mental health virtue. Adaptability is mental health. We all should be able to adapt to any changing situation. If you can't adapt, then you seriously need to look at your mental health. If you haven't adapted to the changes, look at it and accept the things that you can't change. I will be doing that in the last slide as a prayer for you all and for me, that we need to accept the things we cannot change. Now, take care of yourself. Self-care is important. Especially, I request you all to maintain boundaries between the personal and the professional. Maintain this balance and boundaries between the personal and the professional. It's important. Like for me, for instance, usually, unless I have a late evening webinar with the other countries where we have to be online in the evening, after around 5, I do not do any official work. It's my time. It's my personal time. I just laze around. I just go lie down. I don't do anything sometimes, or sometimes I'm baking a cake, or sometimes I'm in my garden, or I go and walk. But maintain these boundaries and maintain a balance. Okay, and acknowledge your wins. Suppose, like for instance, when I do my class well, when I do certain things well, it's okay to celebrate. It's okay to celebrate. Go have a good snack, bake something, make something nice that day. or it's okay not to do anything certain days. It is perfect. There are my days when I don't do anything at all. I just enjoy just relaxing. Okay. And stay calm. Be a learner. That's very important. Be a learner, constantly upgrading yourself, learning new things, and think positively. Try to, I'm a very positive person. I'm a very, if I can use the word resilience, resilience is like, you have a rubber band. You all know what a rubber band is. So when you pull a rubber band and you let go, it bounces back to its original shape. We need to be like that. We are all stretched. We are stretched because of the pandemic on one side. You're stretched maybe because financial problems and loss of job on one side. You're stretched because of the online class, the demands that it's bringing, but you should be able to bounce back. Okay, so you should have that kind of a strength and a capacity within you to really bounce back in spite of being stretched, in spite of having negative thoughts. None of us are perfect. All of us have negative thoughts. We all have our stressors, but we really need to be able to bounce back. Embrace the change. This is a change. Embrace it. Hug this change. I tell people, how many times as teachers you've said, I wish I didn't have to go to school. I wish I could sit at home and do my work. I've said it 100 times. And God has given me that opportunity. I wish I could spend more time with my children. I wish I could cook more. I wish I could take care of myself more. God has given us that opportunity. Embrace this change and move forward. And I think by doing this, you really can mind your mind in the coming days. Even as we go into 2021, there is uncertainty around us. We really do not know what is going to change and what is not going to change. Looks like this pandemic has come to stay for some more time. From the reports of other countries, which is going to the second and the third waves of the pandemic. But whatever it is, embrace the change and move forward, because our attitude matters and we need to stay in perspective. If we do not stay in perspective, it will create a lot of problems for us. And I close with this beautiful prayer that has been my prayer for a very long time. And it is there online. And if you can find it, it is not associated with any religion. It's just a prayer. And this prayer says, God, grant me the serenity to accept the things I cannot change. Serenity, you need this kind of peace of mind to accept the things I cannot change. I can't change pandemic. I can't change this online thing that is going on. I cannot change it. I need to accept it. I need that kind of a peace within me to embrace that change, to accept that change. But what do I need? Courage to change the things I can change. What can I change? My teaching skills, my online way in which I'm approaching the students, the way in which I communicate to my students. We need to really change what we can change. Okay, change your style of working, change your mental health, start exercising. Maybe somebody at home is going to say, "Ennachu unakku, didn't exercise pandra." It is okay. That's fine. Change what you can change. Maybe you need to change the communication patterns in your house. Spend more time in talking with your children or with your spouse. Okay, what are the things you can change? Maybe you have not spent time spiritually. Maybe that's something that you can change now. And God, give me the wisdom to know the difference between what I cannot change and what I can change. And if we follow this prayer, let me tell you, our wellness will be in our control. Our mental health will be in our control. And we really can think positively, move forward, be more resilient in what we are doing. Okay, so don't be anxious. This is a beautiful, again, another little prayer of mine, and don't mistake me that it is from any religion, but this is just a prayer of mine that I say, be anxious for nothing, but in everything take it in prayer with thanksgiving. Just every day is grace that we are alive. If all of you, about 500 or 1,000 of you, are sitting today and listening to this webinar, just say thank you, Lord, in whatever language you want to say it, in whatever form you want to say it to your belief system. Just say thank you, Lord. And I think if we can do this, I'm sure we can all mind our mental health, mind our mind, and take care of our well-being during this pandemic time. Thank you all very much. Stay safe and God bless you all. I'm so happy to connect with you all, and I hope I was able to reach out to you all. Thank you so much, Sharon.
Thank you, ma'am. Thank you for this thought-provoking session. Ma'am, I have a couple of questions for you.
Yes,
Uh,
ma.
a teacher from Chennai has asked, as a teacher, in addition to the stress in the online work environment, it stresses me more that what will others think about when I complain that I have stress.
Okay. Yes, like I told you, no, in India, I told you even earlier, I said mental health is an unaddressed agenda. We don't talk about our mental health. We will talk about our physical health, we will talk about it. But mental health, we do not talk about at all because there is a lot of stigma attached to it. And therefore, you'll find my PhD was on gender differences in mental health. So I studied about 500, almost 1,300 men and women, and I looked at how men and women are coping with their mental health. And I found in my study that women internalize their problems. That is why we come with somatoform disorders, kai kal
Mm.
kodichal, neck pain, body pains, headaches, now all kinds of problems we have. Men externalize, and that is why we find habits, addiction, abuse, violence more among men. And we are not able to verbalize our mental health needs. I think we need to break this, and we need to talk about how we are feeling. That is why I said mindfulness, being in the present, understanding what you're experiencing, and talking to others about it. Okay, especially to your spouse if you're married, maybe to your children, to your, just call your mother and talk to her, call your parents, call your sister. A lot of us do it. We call our sisters or our brothers, somebody, and talk to them about what you're experiencing. Or your peer group. I'm sure you all have a peer support within your own schools, a teacher you're very close to. So this is something that you can do. I know there's a lot of stigma attached to talking about mental health, but I think it is health. It's part of health. You talk about your eyes, கண்ணு சைட் ரொம்ப கம்மியாயிடுச்சு after coming to online class. Headache after coming to online class. Back pain after coming to. You're talking about that. Why can't you talk about your mental health? Yes? Yeah, I see a little child there. Hi. Okay, so talk about your mental health is very important. Yeah, Shivagami's little one is there. Hi. Okay, so talk about your mental health is very important.
Ma'am, there's one more question, and this person says, I find certain symptoms that you mentioned, like insomnia, being irritated, anger issues in a person at home.
Ah.
And I understand that this is because of the lockdown, and I'm not sure how to handle it.
Yeah, I think it's
This is in a
important that
person in
we.
the family who's,
Okay,
I think, a teacher, or like she
okay,
sees this in a person at home. Then how do
yeah,
they handle
yeah,
it?
yeah. Okay, I think the first thing is, like I told you earlier, we need to talk about it. We need to understand what is happening.
Hmm. I think there's some
What to do with
technical,
themselves.
ma'am. Ma'am,
Pardon
I'm
me?
sorry. I could not hear you. Things went mute
Yeah, it says
after
my
the
internet
question.
connection. Yeah, it's saying my internet connection is unstable.
Sorry.
Maybe I'll stop share. Maybe that will reduce the. Yeah, is it
Yes,
okay now?
yes, ma'am. I can hear you. Soon
Okay.
after the
Yeah,
question finished, I could not hear anything
yeah,
that you said. I'm
yeah.
sorry.
Yes, yes. So I said, one, as I told you earlier, we need to talk about it. Very often we're not talking. So if there's somebody in your family is going through it, talk to them about it. Ask them what is going, what is happening. Second, engage family in activities, because what is happening is all of us are just doing our little bit of online, and then we're not doing anything. Each of us are just sitting in our own places, not doing things together. I think it's important that we engage in activities together, even if it is your spouse, even if it is your children. I think get engaged in activities. For instance, we do a lot of gardening together. We do a lot of cooking together as a family on weekends. Okay, so we have a lot of these things that we've done together. Fine, cleaning together, lot of things that we've done online, and that has really helped in keeping the family together and keeping people free from stress. Like lunchtime, I make sure I make my lunchtime along with my children's lunchtime. Both of them are working, so whenever they're free between two, it's a little late, but I like to sit and eat with them. We try to have dinner together. So these are things. So if you can do that, that will help. Third, If it is not helping, then you need to speak to a professional person. You need to talk to somebody about it. Don't simply sit back, because we always do that till it becomes a major issue. If it is not helping by doing these small things, then you need to seek professional help. Yes, Sharon.
Thank you, ma'am. Thank you for addressing those questions, and thank you for the thought-provoking session that you gave us. Teachers, I really hope and I wish that the session was helpful for you, and also the question answer session. And there is the feedback form that has been sent to you as a link. Faculty members and teachers, you can fill in those forms. Based on that form, you'll be receiving your certificate. Um, yeah, ma'am, we have 500 participants in Zoom and more than
Yeah,
250,
good. Mm-hmm.
250
Yes.
in YouTube. So putting together it's 750. I've heard your thought, and I definitely hope at least a few of them will take a positive note on it, and it will bring about a change in them.
Yeah, I think somebody has said that, though we are putting a lot of efforts, parents are not appreciating, and it's kind of frustrating us, and they're finding fault with us. Don't worry, it will happen. People will always find fault, but you go ahead. But what you need to do is improve your skills, because online presentation skills are very different from sitting in a classroom, physical presentation skills. Okay, you have to really improve your physical presence on an online classroom, in terms of the tone of your voice, your eye contact, your facial expressions, the material, the way you speak, everything. We need to do it. So you have to take those efforts. At the same time, when you're doing your best, do not worry about these critics. It will keep happening, ma. If we keep taking everything to heart, then we will get affected. Do your best, and be assured that it will be taken care of. And just reach out. All I'm telling you is, just reach out to your children. Just reach out to your children. If you have not called your children over the last 10 months, please call them. Please call them and find out how the family is, find out if they're all right. Let me tell you, it will really help in connecting with the parents also. The Zoom parents teachers meeting is of no use. If you're a class teacher of class 7 or class 9 or class 10, make some calls, talk to them. It will help a lot, even in dealing with these critics from the parents.
Thank you, Dr. Miriam Samuel, for the
Yeah, yeah,
thought-provoking
pleasure.
reminding of my. I personally believe that participating in the webinar, I know we are at the end of 2020, but as ma'am rightly pointed out, this ain't leaving us. This corona ain't leaving us even in 21. So this webinar is the right place and the right time to address our stress, our mental health, and how do we keep ourselves in a balanced way. Um, and the feedback form, the link has been sent to you. Kindly do bear with me as I am also learning. Okay, the feedback forms are being sent to you.
Sharon, sorry to butt
Yes,
in, but
ma'am.
I hope in one of your webinars you'll also do online etiquettes, like how do you
Definitely.
manage yourself online? Yeah,
Yes,
yeah,
ma'am.
especially the
It
way
is
they present.
actually, yes, ma'am. Proceed,
Yeah,
please.
that's very important. Yeah, even
We
when they
have a
come onto
technical
Zoom or a
section.
thing, yeah, if somebody can do that, because see, when you log in, you should actually switch off your audio and video when you log in. But many of
Mhm.
us don't do it. And we are not even aware that the video is on and the whole room is being seen. Fine. So if, it'll be really good to do that online etiquette training by your technical team. Thank you, Ma. Sorry I
Yes.
butted in. Thank you.
No problem at all. Because we are actually working on a technical session for the teachers and how do they handle themselves online. So you have given us a starter. So teachers, the feedback form is there online. As you fill in those feedback forms, I take this time to thank all of you, the teachers, faculty members, principals who parted with who are a part of the seminar. If not of you, I don't think we would have succeeded. And a special mention to our guest speaker. She is a very busy person. I know that personally, and she has spared us this time to be a part of this webinar, ma'am. I don't think how many times I. It is not enough. me thanking you once. I should be really thankful for your time that you spared for us. And our executives, our regional executives, all across India and UAE, they brought this message to you, the school, the teachers. I should also thank them, and this is the right time to do so. And also our core team who is working. You only see me in front of your camera, and there are people right on the other side of the camera who are working on it. And I should thank them, take this time and thank them as well. So um, as I told you in the beginning of the session, is dealing with the global experiment. Minding Our Mind in 2020 is the first in the series, and the second session will happen on 27th of December, for which the link will be sent to you. And I know ma'am can recognize this person. Tonte West will be the speaker um, for the next session. The new jugglers, it is called. Ma'am did address a major part of the session of juggling. How do we juggle work? But it will be dealt in detail by Tonte West on 27th November, 3 p.m. You can log in at 3 p.m. Thank you all for being a part, and you have been so patient. Many of you have logged in at 2:30, and you have been so patient with us until 4 a.m. and you're still here. Thank you so much for being. Until we meet on 27th, this is Sharon, and I take leave. Bye bye. Uh, Teachers who are still here, the link is on your screen or in the chat box. Kindly use that link to fill in the feedback form for today's session. I really believe that the session would have been informative and useful for you. Fill in those feedback forms. Based on the details that you provide in the feedback forms, you will be receiving a certificate. And I'd also take this time to remind the next session, that is on 27th, 3 p.m., the coming Friday. Tonte West will be the speaker of the day. And for more information and details, you can follow us on social media like Facebook, Instagram, and Twitter. And also, you can see our website, technoschool.in. Teachers and faculty members who have joined with the seminar through YouTube, there is a link in your chat box, in the description box, I believe, for filling the certificate, for filling the feedback form. Upon filling the feedback form, you will be receiving the certificate through mail in a day.